Hello and welcome to Linking with Child-Focused Approaches when Preventing Sexual and Domestic Violence. I am Ashley Meyer. I'm with Prevent Connect, and I'm so happy to see all of you here today. It looks like we have folks in the text chat introducing themselves, saying where they're from. It's humid and sunny in Florida, all the way up to much cooler at the Canadian border. So I appreciate that. And it looks like we have folks from all over. So welcome. Today's session is being recorded, and you have joined Linking with Child-Focused Approaches when Preventing Sexual and Domestic Violence. It's a Prevent Connect web conference, and as you've likely already visited to register for the web conference, we have PreventConnect.org. That's our hub for this online community of practice around sexual, domestic, dating, and related forms of violence. And we have an email group as well. We have an e-learning site. We have a wiki. We have all sorts of social media. And we really encourage you to utilize these resources that we make available so we can really have a vibrant community here. And let's talk about how to use this technology. I want to ask you all to go ahead and raise your hand. It got cut off in my picture, but it's right here next to the phone number on the top left of the screen. You can just click that button. You can raise your hand, and that's how you can let us know that you have an issue or you want to make a comment or you have a question. We'll likely be contacting you in the private chat tab. So if you look into your chat box, you see public where everyone's introducing themselves, and right next to that says private. So if you have a message there, the person's name comes up and there's a little exclamation point next to it, and that'll let you know. And you can also use that to share information about, maybe your contact information, your phone number with individuals, and that way you don't have to put it in the public chat if you would prefer not to do that. Okay, I see that we have hands raised, and you all figure out how to lower them as well. So I appreciate that. I'll just go ahead and I'll lower the rest of your hands. So thank you for demonstrating and trying that feature out. We have PowerPoint slides as well, so if you're having any issues with seeing the slides, all you have to do is look to around the top middle of the screen. You should see a gray tab that says Today's Slides. If they happen to look like they've disappeared, they will come back if you click on that tab. So we have PowerPoint slides. They are available in a PDF version. In the beginning of the chat, I did paste that link. I'm going to go ahead and paste that again so you can see that in the text chat. I just posted the link where you can download the PDF version of those slides. And we have polling questions. So I'm going to go ahead and we'll use that feature right now. So I'm going to ask you a question. So I'm hoping you can all see it. There are options you can click on. So you click the little circle, the button, that is your answer. So have you attended a web conference before today? No, this is the first web conference you have ever attended. Yes, so this is the first Prevent Connect web conference you've attended. Yes, you have attended 1 to 2 Prevent Connect web conferences. And yes, you have attended 3 or more Prevent Connect web conferences. So I would love for you to go ahead and click on your screen to answer that. You don't need to put it in the text chat. You can just click on the screen. Looks like some folks are saying you can't see the question. So let me see if this shows it for you all. No question. Interesting.
Yeah. It's blank on mine too, Ashley. What a surprise. That's
interesting. Oh, is it just like a white screen that you're seeing? Because it's also not showing me.
It has the tab pops up to beginning polling question, and then there's just nothing in the tab.
Yeah, interesting. Okay, so then maybe let's go ahead and do that in the text chat. Just yes or no, have you attended a Prevent Connect web conference before? Would be great to see if you could go ahead and put that in the text chat. So we'll see, and I'll go ahead, Annie, and I'll introduce you since we're going to be looking at this.
Mystery voice together.
Yeah, so this is Annie Lyles, who you hear, who is from Prevention Institute, who's been a partner with Prevent Connect for a very long time. And Annie will be your facilitator for today. So welcome, Annie.
Thank you. Thank you. It is wonderful to be here. And do you want to try to do the other polling question?
I will try to do that. We'll see.
So one or a total functioning meltdown here.
Yeah, it's interesting. But if we look at the text chat right now, it's a good mix. I see quite a few yeses, but as soon as I think it's an overwhelming yes, then I see a lot of no's. So I think we have a mix. So welcome to those who are coming back. And for those of you who this is new, this will be, as our colleague David Lee says, the fastest hour and a half of your life. And we look forward to you joining our community here. So I am going to see if we can ask this other question, if it shows up for you. It's going to hopefully be, what best describes your organization or agency? So,
hey, there it is.
Yeah. Okay, great. So you can go ahead and you can put that answer, just check the box or the circle there if you're from a sexual violence agency or coalition, and domestic violence agency or coalition if you're dual, you're from an educational institution or a public health department or government or tribal entity, if you're from other community-based organizations that focus on things like child abuse, HIV, STI, reproductive health, mental health, healthcare, LGBTQ, individuals, community-based organizations, and faith-based individuals, military, if what your organization focuses on, if you could just go ahead and click that, we would appreciate it. And it looks like all you have to do, I see some questions, is there a submit button? No, you just click on the screen. So just click the circle next to the answer that is appropriate for you. If you're other, go ahead and type that into the text chat, please. We would love to learn more about where you're from. And Annie, I've shared the results. I'm hoping you can see those. Looks like we have a large majority of folks who are from sexual or domestic violence agencies or coalitions, or dual agencies or coalitions. We have a good amount of people from government, from public health, from educational sectors, and also from other types of community-based organizations, looking at mental health, healthcare, military, criminal justice. We have some funders, foundation folks, and we do have some other. So I'm looking, there's home visitation I see in the text chat. Looks like press grant
our good
folks.
buddy. I was just going to say our good buddy Debbie's here from the National Center on Domestic Violence, or Domestic and Sexual Violence Resource Center, I think. And yeah, and we have all kinds of folks, and even some child protection folks and some criminal justice folks. So fantastic.
Yes. Howdy, Deborah. Or Debbie,
howdy,
sorry.
Deborah.
Howdy, I saw that.
Just a reminder for folks, if you're having trouble with sound through your internet, you can call in and just we'll put that number in the text chat for you there. Be sure to just call in if your audio is coming in and out. That usually is something to do with your internet connection and not something that we can do anything with.
Right. And for any of you who are not seeing the slides, I've withdrawn those polling questions, so that shouldn't be showing you any kind of a white screen or anything like that. You can just click on the tab on the top. It's right about in the middle that says today's slides. So if you're not seeing those, you can also go ahead and go to the link that I'm pasting into the text chat, and you can download those slides on PDF. So I will be addressing any private messages that have been sent to me in just a bit. Right now, I do want to make a note about the phone audio. The quality of internet audio is dependent upon your connection, so we do encourage you to call in to the number on the top left side of your screen if you're having any issues with that. We do have closed captioning by our wonderful partners who we appreciate so much at Aberdeen Captioning, so we want to thank you for that, Aberdeen. You've been wonderful partners throughout the years. And we do have general web conference guidelines. We just ask you to stick to what you would expect of others as well. So we want to have we always have a really vibrant community and conversation going here, and it's always respectful, and we would assume that it will continue to be so. So we thank you for that. If you're having additional tech issues, you can call iLink Technical Support at 800-799-4510, and they will be able to help you. Prevent Connect is a national project of the California Coalition Against Sexual Assault, sponsored by the U.S. Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the U.S. government, the CDC, or CalCASA. So with that, just a little bit more about Connect. I want to show you here, I'm going to put their pictures up. Abby Sims with her lovely laughing picture is my colleague at Prevent Connect as well, and she's here today. And so is Dina Fulton, who is here as well. You'll probably be interacting with them throughout the text chat. They might be private messaging you as well to answer some of your questions. So thank you, Abby and Dina, for joining us today. We focus on, as I said earlier, domestic violence, sexual violence, related forms of violence, dating abuse, violence across the lifespan. And we really want to focus on preventing violence before it starts, which of course we'll be talking about today, and connecting not only to other forms of violence and oppression, but we really want to connect to each other, to other prevention practitioners. And that's why we're all here in this virtual room and community today. So with that, we will look at the fact that we have 2 more web conferences coming up in this series. On July 9th, we're going to be talking about joint strategies. On August 13th, we're going to close the loop. And I encourage you to refer back to preventconnect.org to see when registration will open. Shortly for joint strategies, it will open. And then after that, for closing the loop, it will open. So stay tuned for those registration announcements. And now, any further ado, linking with child-focused approaches when preventing sexual and domestic violence. Today's objectives are to identify strategies for doing this. We're also going to discuss benefits and considerations when we're doing this work. And we're going to be looking at toolkits that are going to increase implementation and effectiveness of these efforts that we'll be talking about today. So I've already introduced our presenter and facilitator for the day, Annie Lyles. Annie and I met each other years ago doing this type of work in San Diego, and I'm so pleased to be working with you here at Prevent Connect. Annie?
Thank you very much, Ashley. Wonderful to be here. This is wrapping up my 8th year with Prevent Connect and doing these web conferences. I'm very excited. My maternity leave starts tomorrow, so I made it. I'm super happy to kind of finish on this high note with our wonderful guests here today and such an interesting topic. So there are at least 200 of you in the audience. I know sometimes we get multiple folks viewing, but Watsonville in California, where I had some strawberries grown there earlier today, all the way up to Vermont and Florida. This audience is one of my favorite ones. You didn't get to see it, but usually about 30% of you have been on 3 or more. You're kind of family here. About 30% of you come on, occasionally when the topic is right, and about 30% of you are new. And so welcome to Prevent Connect. This is an informal platform. We ask questions of each other. As you can see from the text chat, we use that a lot to be much more participatory. If we as preventionists had the answer to this question, we would have just sent you a brief. So this is really a place to discuss and go deeper on an issue that's of importance to the field. So pleased to have you here. Please don't be shy, and let's get to it. All right. Big thank yous to Casey and Alexis. They are I was about to say manning the text chat, starting off our conversation with some gendered language. They are being responsive to the text chat and are teching today. This is Casey's first time teching, so welcome, Casey. We're so glad to have you here. And let's keep moving. All right, so first thing I wanted to get to is why a child-centered approach? What got you interested in this topic? Because to be honest, when I put it together, I wasn't sure how much it would resonate. I think it's an important thing to consider, but I wasn't sure where folks were at. And so if you could use your text chat to chime in, what made you interested? We had an insane amount of registrants for this web conference. So I know that this is something folks are interested in, but I'm always curious what about it got you interested. What about it? What might be relevant? What are you thinking about as you join in today? So if you could use the text chat, that would be great. So let's go ahead and leave behind weather. And Michaela asked about downloading the slides, Ashley. Is that through the link?
Yes, that is through the link. I'll go ahead and post that again. It's a PDF version that you can get on the link that I just put in the text chat. So you can go over to preventconnect.org and get those. So let's look at why you all are here. So why the child-centered approach?
So Kay brings up adverse childhood events, or experiences, I think, affecting health through the lifespan, and that's a huge topic right now because abuse begins in childhood. I saw Clarissa is talking about implementing primary prevention for middle schoolers.
Mm-hmm. Oh, I like Dana says, I don't really know what it is. What does it look like, and what does prevention look like? So that's a great, great question and something that we'll be addressing today.
Yeah, and I think Dana's point, I know trauma impacts children, but what does the prevention look like? And you're going to leave with probably 50 examples, Dana. We've got some really good examples for you. And lots of young children. And Dawn mentions preschool.
Mm-hmm. Yeah. Brian is the child witness to violence counselor at a domestic violence / sexual violence agency. So yeah, it looks like we have a lot of folks who are here because this is the work that you do.
Yeah, this looks like a lot of folks that are working with children or training of trainers. I saw that in there, and training of counselors. Jan brings up, can we focus on early childhood education initiatives? Are there some links in there? Interesting. Cool.
And Sandy also points out from a prevention perspective, it's really effective if we work with folks when they're at a young age rather than wait until they're adults.
Right. Or wait until they're in need of shelter. I mean, that's when a Zinc Prevention Institute really was founded on the notion that it's really important to have options for shelter for after the fact, and we can't let that we can't let that be our only focus. We also have to prevent violence from occurring in the first place. So absolutely. Wonderful. Okay, well then let's get to it, and thank you so much for chiming in with your thoughts. This is really helpful for us as we think about the questions we ask and what we talk about. One of the things that I think is really important as we start this conversation is looking at the linkages between violence. For a lot of folks, they're stuck in that kind of perpetrator mode, and it's, how often is someone that's experiencing child abuse also doing, DV, or how is it, adverse childhood experience is tied to later perpetration? At Prevention Institute, we're looking at this issue much more broadly. So when we think about the linkages between multiple forms of violence, we know that they're often experienced together, that these forms of violence share common underlying factors, and that they also have common impacts for individuals, families, and communities, like you mentioned with ACEs and with trauma. Those are common impacts. It doesn't really matter what type of violence it is. You still get the trauma. You still get the ACE impact. And then we know, of course, that exposure to one form of violence increases the risk for further victimization and engagement in violent behavior. But for me, the aha of this is that the understanding of how these things are kind of experienced together, they have underlying factors and common impacts, which means we don't always have to focus on a specific form of violence. Hey, Ashley, I'm getting a little like a blip noises here. So I don't know if that's you. Yeah, it's kind of blippy. It sounds like your phone. Not to point a finger.
Yeah, that's interesting. I am not getting that, but let me go ahead. I will mute all lines again, and then I might also switch my phone. So let me do that first.
All guests have been muted. You can unmute your line by pressing *6.
All right.
Okay.
Thanks for the pause there. Oh, and I do want to, before I go too far, Meredith also points out that this is a positive approach, and we're going to talk a little bit about that more today. Just in terms of kind of the linkages and why maybe we don't need to lead with one form of violence, this is from the National Survey of Children's Exposure to Violence. 1 in 10 children in the U.S. are either witnesses or victimized by co-occurring forms of violence, 1 in 10. And one of the things that sticks out to me in this statistic is that it's not a random sample, right? Not any 10 children. We know that violence is clustered in communities that have these, social and historical factors that makes violence more likely to occur. And so we know that in some classrooms it's much higher than 1 in 10. In some daycare settings, it's much higher than 1 in 10, especially when you think about community violence and how often young people are exposed to that. We know that the ones that experience multiple forms of violence have a higher risk of chronic disease and more severe symptoms. One thing I wanted to pull out, and it sounds like it's good for this audience, is that those risks are especially high when exposure to violence involves a fundamental loss of trust and security. And it goes back to some of that caring attachment piece, having adults that you're connected to, school connection, and how important it is to maintain that, and if it's broken through violence, to heal that. One of the other things we like to point out is this is about developmental growth, and there's all kinds of developmental aspects. This is research by David Finkelhor. He does amazing work on this topic, and he points out that it doesn't really matter what form of violence it is. Younger to older kids, all of their development becomes impacted when they're exposed to violence. And so for him, and again, this is Finkelhor again, he says, if we don't honor the links between these multiple forms of violence, we're underestimating the true scope of victimization. We limit ourselves in identifying children who are poly-victims. So kids that are coming in, that may be exposed to community violence. Well, we're doing DV today. We're not talking about that, It's unnecessary competition for scarce resources. We've reduced our policy influence. I think this is a real interesting one. And I know Futures Without Violence, one of our other partners, is really thinking about this from a policy perspective and really thinking about what children need rather than what form of violence it is. It reinforces arbitrary distinctions, and it ignores the perspective of the child and the community. And so for all of these reasons, we wanted to bring us, this group together to think about, all right, so what would approach look like that was much more integrated? And we went with child focused for exactly that reason, because it's a prevention message and it's a positive message. The prevention approach is needed because we can't let children be exposed to so much violence and only focus on healing them afterwards and not preventing it in the first place. So two of our guests here today, Donald and Trina, they both have been working on this issue and thinking about it in their communities. Donald is in St. Paul, Minnesota in Ramsey County, and Trina is on the Rocky Boy Reservation in Montana. And so I just wanted to introduce both of them briefly and let them share for a minute, why is prevention important to them? And we'll get to the programs and what they're doing first, but I wanted to just talk a little bit about the approach. Donald, just to do a more formal introduction, he's the manager of Healthy Communities Division in St. Paul. He's the founder of and has worked with the Initiative for Peaceful Families and Communities since 1990, and his primary areas of focus include workplace violence prevention, efforts promoting peace among men and boys, and development and implementation of the Wakenza, and I might not be saying it right, project in the family transformation model. Donald, welcome.
Thank you, Annie, very much.
Any thoughts on the conversation so far? What are you thinking about as we start thinking about a child-centered approach and why that might be important?
Well, I've really enjoyed reading all the comments that people have had. And I guess, just as we start out with thinking about prevention, I was just talking with some colleagues about this earlier today. When we get into the field of violence, it can sometimes be hard to really embrace the notion of primary prevention, which really, and as you've already started to talk about, it means trying to prevent this from happening before it even happens. And that's really been the focus of our work here for 25 years. And I guess what I would want to say, and I'll explain more about our work later, but I've really, when the work started, I wasn't sure, to be honest, if it was possible. Given how ubiquitous violence is in our culture and our communities, these many years later, I've really come to be very convinced that it's very preventable. And working in a public health department, I really believe that violence is probably one of the more preventable issues that we work with when you look at the breadth of what we do in public health, because it really comes down to humans and human behavior. And I believe that at our core, violence is not natural to humans. It is not what we seek. And that if we can return to really the best within ourselves, it becomes very preventable. And for our children, there's just no question. Annie, I didn't know you were going on maternity leave tomorrow. We owe it to your child and to all of our children and to ourselves.
Yeah. What made you change your mind? Was there an aha moment? Was it a kind of building, or what kind of brought you over to this the side that violence really is preventable?
Well, it was the work that we've done here, and it's the Linkages project, and it's that work, and I don't know if you want me to go into that now, or I thought maybe I'd be going into it a little bit later, but I guess the quick answer to that is that, and I think this is important for all of us that do this work, when we talk about violence prevention, and 25 years ago our county board directed us to work on violence prevention and primary prevention of family violence. And to be very honest, if the however many hundreds of people listening in today were to spend the rest of the month saying what is that, what do those words even mean, we would go in circles because it's too big of a topic and it's a little vague. We then focused our efforts down, and I'll be explaining this later, but what we ended up doing quite a while ago is focusing our efforts for today's conversation on working to reduce harsh treatment of children in public places and isolation of teenagers, with the idea being that if we could reduce that, we could then reduce the violence that might happen later. And in doing that work, it was kind of shocking, to be honest, how easy it is to accomplish that. And in seeing that accomplished in a whole range of organizations ranging from children's museums to domestic violence shelters to actually more recently detox centers and clinics, seeing how very small changes just make huge differences in people's behaviors, it's shifted my thinking about the possibility, and I'll explain that more later.
Fantastic. Thank you so much. Trina, let me give you a more formal introduction. She is the project director with Rocky Boys Children Exposed to Violence Project on, as I mentioned, Rocky Boys Indian Reservation in Montana. She works closely with her collaborative partners to provide services to the community members, and she was nominated and confirmed as a member of the Native American Fatality Review Team, the first in Indian country. She's a member of the Child Protection Team, Multidisciplinary Team, Sexual Assault Response Team, Elder Protection Team, and began training to become a child forensic interviewer along with her colleagues. So as you can see, we're very excited to have someone so well-versed in this field and been thinking about this topic for a long time. Welcome, Trina Wolf-Chief. And Trina, you may need to push *6. Are you there?
Yes, I'm here. This is Trina.
There, fantastic. I wanted to ask you about prevention and kind of how you think about it. I know the work that you do spans prevention and intervention, and the things that we'll be talking about today, your family nights and the regalia making, really fit squarely in prevention. But how do you see, how do you see yourself bridging these two things? And is that hard to do? How has it been?
We've been, with our family nights, our whole goal behind that is to bring our families together to participate in the various activities that are provided by our collaborative partners, to kind of engage them to do good, wholesome activities together as a family. So if it's we try to go by holidays with sometimes we end up going by holidays or just maybe the seasons. So we did cookie decorating, ornament making for Christmas, but it's just a family activity. So we'll have parents, grandparents, other caregivers, even older brothers and sisters there with the younger siblings, and they're actively at these tables creating ornaments to take home for their Christmas tree or
Trina, I'm so sorry to interrupt. Some of the audience is having a hard time hearing you. If you could speak up just a little bit.
Okay. Is that better?
Yeah.
Okay.
There you go. That's even better. Thank you. Was it hard to start doing prevention work in a community that had been exposed to so much violence?
It actually was, because in our community we're mostly in crisis mode. It's when there's a crisis, it's we sit around and wait for crises to occur, and so we're always ready to jump on the crisis. But since we've been doing the prevention and we're trying to stay ahead of the game, and with our community, we're trying to take a different approach.
Yeah. Well, wonderful. Well, I can't wait to share more about the work that you're doing and how you've made that shift kind of from getting ahead. And let me give a couple of examples to our audience, because I know there are some folks thinking about what prevention looks like. We always think, it's how do we prevent is the problem from occurring in the first place. So it's not screening, because then something has already happened. It's actually going upstream. And some young people in Philadelphia helped us with the term. For public health folks, you might know primary, secondary, tertiary prevention. But these young people helped us, get beyond the jargon and think about upfront strategies, in the thick strategies, and aftermath strategies. And as Trina pointed out, a lot of the times, the really caring, really devoted folks, they are in the thick. They are there right in the mix. They're willing, they're able, they're giving, and they're also there in the aftermath, right? And so what Prevent Connect focuses on is these upfront strategies. What can we do upfront, as Donald kind of pointed out, to change environments and make violence less likely to occur? And this is the model we use. There's all kinds of fancy ones and simple ones, but just really important to think about that it's not just behavior, that one of the most important elements that impacts health and safety is the environment people are in. What's bought, sold, and promoted in your community, whether it's community norms or the built environment, really impacts behavior. And so a lot of the things that we'll be talking about is about shifting community norms and shifting community environments to get to behavior. I think that's one of the biggest shifts for those of you that are new to the field or new to Prevent Connect. Sometimes people are very focused on individual curriculum, which is about behavior change. And behavior change is important. But when so many things are pushing in the cultural environment in one direction, we know it's better to place the onus on shifting that culture than it is to kind of try to work with each individual person. We have an example here today, and we just finished an analysis on the Defending Childhood Initiative at Prevention Institute. There's 3 goals there: prevent and reduce violence, fit community priorities in existing assets, and develop a comprehensive strategy to prevent children's exposure to violence. So as you can see, this is a child-focused approach funded by the federal government, really first of its kind, that it's not specifying what type of violence, but they're really thinking about this as a child-centered approach. And let's see here. And it's multi-sector. So I wanted to bring it to the Prevent Connect audience, one, because domestic violence and sexual assault is part of the violence that they're able to think about in this project, but they also think about community violence and other forms of violence, bullying, but it's all from this child-centered approach that's multi-sector. And so I thought, this is great. It's a Department of Justice initiative, but we can really learn something from this, I think. And so that's kind of the analysis that we'll be using and some of the examples that we'll be using today. Here are the groups that have been funded. We have the grantee on the left and the city and state they're in on the right. So you can see we've got, the city of Boston, big city that's done a lot of work with public health departments preventing violence, and it is their public health department. It's the city of Portland's public health department. But you know what? That's Portland, Oregon. That's not Portland, Oregon. I'm sorry. It's Portland, Maine. Somehow these got a little bit off track. So you can see the Chippewa Creek Cree tribe is Box Elder, Montana. City of Boston, Boston, Massachusetts. I apologize. They're just a little off right here when we pasted them in. But anyway, the point of this is we've got big cities, big city health departments that have been doing this a long time, and rural areas that are brand new. A nice mix of grantees that have been working on this. So really quickly, for those of you in the audience, I'm wondering, how familiar are you with this Defending Childhood initiative that I just described? If you could use the feedback box in the bottom left that just popped up, A, B, C, or D. How much do you know about this initiative? Are you a grantee? Do you partner? Don't use the text chat. If you can, try to just click in that bottom left and you can see all the answers as they're coming in. So I see that 88% of you haven't even heard of this yet. Again, don't use the text chat. You can use that feedback in the bottom left and we can watch our pie chart move. There we go. Now I'm getting it in there. Ashley, are you
very
seeing
pink
that?
right now. Yes, it's very pink. Pink is winning, and that's D. Yes, this is the first time hearing of it.
It's not a competition. But yeah, so this is good. I wasn't sure if you all had known about it, but there's a lot to learn here from this initiative because it absolutely matches the public health approach. And they've been really thinking and being very intentional about how to do a child-focused approach. So this is great. So a lot of you don't know too much. Some of you, about 11%, are familiar. So if you are familiar, and it looks like we have one, maybe, there's a little sliver of green. Does that show up on yours, Ashley?
You know, I see a sliver. I think it's actually A. It looks like it's periwinkle, perhaps. So it's three. It looks like we have 3 people answering that they are grantees.
All right, so it's more than just Trina.
Yes. But now we have 1 B as well.
All right. So if you are a grantee or if you partner with a grantee, I really encourage you to share your experience with this initiative. I've been incredibly impressed. Their community is very much like Prevent Connect, where it's a community of practice where people are thinking through, and the real push for this work is their passion and their commitment to children. And they're folks from different forms of violence. They're public health folks, they're education folks, they're school folks. And they're thinking about a child-centered approach. So feel free to chime in that text chat as we go. So in our analysis of their work so far, one of the things that we found is that they are using comprehensive approaches. When we do our consulting, I'm always telling folks, if people say they have the answer and it's one curriculum, you should be very suspicious. Violence is not a simple outcome, and so one thing isn't going to prevent it in your community. This is my new favorite slide from FSG. Most of you probably have heard about collective impact, and that's using a multi-sector approach, which is what Defending Childhood does. And basically what they're saying is, there's simple things. You bake a cake, you have a recipe. If you follow the recipe, you pretty much get a cake. Sometimes things are complicated, and so, it's a much more complicated formula. But if you follow the formula, the rocket gets to the moon. Raising a child is complex. You can't do the same thing over and over again and get the same answer. Even something that works today may not work tomorrow, and that's a picture of my daughter. I adjusted their graphic a little bit to throw Sophia in there with her dad. That's her, I'm being compliant mom, but I'm really not into this space. But it's just amazing to me that sometimes we treat violence like it's like baking a cake. Here's the one thing we do it over and over again, rather than really understanding, these are people. This is a human situation, and we can't just do one thing. And Defending Childhood and Public Health understands that and knows that we use a comprehensive approach to looking at violence, which means we'll do individual skills, but we also do community education and educate providers and work in coalitions and networks. Multnomah County, Oregon is one of the Defending Childhood grantees, and they're using the Coaching Boys into Men curriculum, and they're using it universally in their basketball teams. And what's exciting is here making the case to the press and to the community is their school board and their public health working together. And so it's just a nice example where we've taken something that maybe is at the individual level, like a curriculum, but actually made it a district-wide policy. And so the strategy is much more comprehensive. If you haven't seen this, the Halls in Boston, this is another project where they've written a script from the perspective of young people. They work with young people to write the script, and they've explored gender dynamics, gender norms, all this just through the perspectives of these high school students. They have it all online. They have all kinds of curriculum that goes with it. And again, it's that individual behavior curriculum, but it's meant to go beyond individual behavior and provide a platform to critique cultural norms, gender norms, some of these bigger issues that teens are dealing with. This is a fantastic work of the Boston Public Health Commission, again, one of the Defending Childhood grantees. So let's look at community education. And finally, we get to talk more, Trina. So we'll get you off of mute here. I wanted to start the discussion. One of the things that you're doing is thinking about how it is you're kind of rebuilding and integrating the identities for these young people. So you're really starting with identity and culture and leading with that as a positive. How did you come up with that as the violence prevention strategy? And Tina, you might need to,
Okay.
I was thinking your voice changed. You might need to hit *6, Trina, to unmute yourself. Hopefully you are there. There you are.
Okay.
Yeah, and just be sure to speak loud there.
Okay. But the approach we're taking is that we're trying to reconnect our family and our children with their traditions, our spiritual ways. Because a lot of that was lost. And so we've taken the approach of, violence was never a traditional way to Native American people, so we're trying to bring that back and instill those values back into our children that we do work with. We also work with their families too, so we're always trying to find alternatives to violence. When we do speak with kids, we try to give them provide them with resources or alternates to avoiding or even reporting the violence to a teacher, a counselor, a trusted adult,
Yeah. Well, I know one of the things that you started doing, and I want to talk about all three, but one of the things you started doing is these family nights. And one of the things that stuck with me when you were telling me the story was that, you were really hoping that maybe you'd get 50 people, and later in the day, you're like, okay, well, at least 30 will be there. And that you had 130 people, and then it's gone up to 700 sometimes that come out for these family nights. And, what's the secret to success there? What do you think makes people so excited to come out to the family night?
We always, because I think they're so successful because we provide them with at least 2 hours. We were having a monthly, but they got to be too much, and they were getting too big. So we do provide the picture, the image that's up there. They're participating, and I think that was our glitter flowers. They're making glitter flowers as a family. There's a mother, her daughter, and the father is standing behind his daughter. But we tried to encourage good, wholesome activities. It's in a drug and alcohol-free environment, but it's just to have them bonding time as a family, kind of reconnecting them as a family.
Yeah, I think Abby points out that this is, it's community connectedness, but it's all the intergenerational connectedness within the family as well, and providing a real positive space for that. Any rules if someone wanted to have a family night? Any lessons learned that you've incorporated as you've been running these for a while?
We always just try to be open-minded. They're not perfect, but we have our little bumps. But it's just
sure.
Just to be open-minded about what other partners. It's really successful because we have our partners coming in, our collaborative partners. We have 10 collaborative partners, and then we have non-partners that we have included, and so they come in. We let them decide what activity they want to do. We never try to tell them what to do, our partners. So I think that's why it's successful, because we give them options. Let them decide.
Yeah. Well, and I know you do talking circles where the elders come in and tell stories, and I know you do regalia making, really positive events for the community that tie back to some, challenging some cultural norms, making space for the positive to grow and thrive. How has that been received by the community and by the leadership in the community?
Our leadership is actually really supportive of all of our work. We did have one councilman, they call them business committee members. He would be like a city commissioner. They do him and his family do come. He has like 4 young children, so they do come. And this one time he came and he said, I thought I was at the wrong place. He was like, but I thought, no, it can't be because all these cars are parked out here. He said, so I went in. He said, as I got closer, I was looking around. He said, because I was expecting to see children outside playing around, trying to get into mischief. And he said, when I go inside, I hear kids laughing, people talking. He was like, and I walk into your guys' gym, and he said, and we have all these children with their parents, their he said Gukum, and Gukum is grandmas, and he was like, all these children with their parents and their Gukums and their Nukums. He said they're Muslims, grandpa. He said they're all in here engaged in all of these activities. He was like, I was really impressed. So we do have he's actually like our vice chairman of our business committee. So
it's wonderful. One of the, I think, most difficult things is, as Abby points out in the text chat, that social connectedness, intergenerational connections, they are risk and protective factors. But when you start doing events like these kind of positive cultural events, there are folks that are really skeptical and, does this really prevent violence? They might want to do like Scared Straight, or they might want to do something very much more pinpointed rather than something that's more child-focused or positive. How have you made the case to your funders and some of the other folks to do something like this that is much more focused on the positive and the family and the child than on a specific form of violence? Have you had to bring evidence or make the case? How did that work?
We kind of had to sell it to our funding agency. We did report it to them, and they just wanted more information. We provided all the information to them. What our goals were, because our goal behind our family nights, our regalia making, and our talking circles. Well, actually, it wasn't really a talking circle. It was called story times. So we did have to tell them, why we wanted to do this. We wanted to reconnect our families, in a healthy, positive way. And then all of our activities, like our family night, our regalia making, everything, there's always like a prayer and everything before and then afterwards. And that's just a norm in our community, that everything begins with a prayer and ends with a prayer.
Yeah. Now, I know there's some evaluation with Defending Childhood Initiative. Has this come up as part of the evaluation?
Yes. During our evaluation, we invited a lot of our collaborative partners to come in, and they spoke well of our family night event. And we're actually able to use Family Fun Night, but some of our partners, they can't use the word fun for whatever reason. So that kind of gets interesting.
I shouldn't laugh. It's terrible, right?
Yeah.
Terrible. Just family night. We're not having any fun.
Yeah. So sometimes we actually have to make 2 flyers sometimes, one that says Family Fun Night and one that says Family Night. So.
Wow. I know that you said you had done the Center for Court Innovations as part of the evaluation for Defending Childhood did a telephone interview, and this came up, right? Yeah,
actually our whole project came up when they did this, and they did talk about specific events too, like what they wanted to see, or if they knew of any of our events or any of our work we were doing in the community, and a lot of them did respond about our family nights and our regalia making and our story time circles.
Yeah. And I know for folks listening in places where you're not doing regalia making, perhaps, I feel like the takeaway from this, and again, Abby's ready to come to everyone's family night, and I'll go too. I love them. Is that it's about starting with the family, and again, you didn't even determine what they would do. Your community partners kind of brought in that piece of what would be fun for the family to do, and it's much more based on kind of the science of that social connection and how you talked about reconnecting the family. And we know with trauma-informed work, that's one of the most important things. And my very first slide, I think, in this, we talked about healing and how violence interrupts that trust with the caregivers, whether that's community and also family. And what you're doing is really strong prevention, but also good for folks that have been exposed to trauma. So when you think about this work and kind of doing this culturally based work and thinking about the positivity you're bringing for the families, you know, what do you think the lasting impact is of this kind of prevention work?
I would hope that we're teaching them like to respect each other, to bring back that family values. One of the things I forgot to mention is like we do provide a meal. Mm-hmm. We can't buy it with our fund or use our grant dollars, but we're pretty good at convincing other people to donate the meal, and so they're actually able to sit down together and eat a meal with their family at the function. Mm-hmm. And we think that's important for them to be able to eat a meal, to sit down together and eat, because that's eating is, it's a big part of our tradition or cultural ways, I guess. So.
That's wonderful.
And for those who don't know what regalia making is, it's traditional Native American outfits they use for like powwow dancing. So.
Yeah. And Trina will be here, so feel free to use the text chat if you have specific questions for Trina. And we're going to keep moving and get to some more examples, but Trina will be chiming in here as we go, and there's some more pictures of the work that they've been doing. Educating providers is another strategy that Defending Childhood grantees have done. So Shelby County was looking at child care providers and thinking about supervision, discipline, caring attachment, things that are just really good for a positive environment at a daycare. In Boston, they were looking at youth serving staff, so kind of a little bit older, and making sure that those staff had developmentally appropriate strategies for working with young people. At the Coalitions and Networks, this is Grand Forks, North Dakota, they were our guests last month. They have an interdisciplinary coalition that is specifically looking at and thinking through these issues together on a regular basis. And in Shelby County, they used a place-based strategy, brought folks together and transformed apartments within large apartment complexes to be these kind of centers and community hubs, kind of the family night model, but it's a family drop-in model where folks can come in and do all kinds of positive things within their apartment complex. The next one, Reaching Men and Boys, and this is an organizational practice. Cuyahoga County specifically funded their family-serving agencies to reach out to young men of color. You've probably heard me say this before, but when we talk about family-serving agencies, usually the folks that we leave out of the family are the ones most impacted by violence, young men. And so what it is was welcoming those young men in terms of whatever that might look like, but ensuring that the services and the prevention services we offered were actually relevant to everyone in their community. And so they had very specific programs to ensure that they were reaching everyone in the community. And now, let's get over to Donald and his work. Donald, this is the slide I use when I talk about your work behind your back, so now you know.
Thank you, Amy.
Now, let me see if I can get this pronounced correctly. The Wakaisa? Is that closer?
Wakaisa.
Wakaisa. So, with the Wakaisa project, I've been super impressed because you're taking a group of folks that really care about children and giving them better ways to interact with families that also prevent violence. So they're doing their normal job of what they do at the public library or at the DV shelter or at the Children's Museum, but they're being able to feel like they're doing it better, and you're also knowing that they're probably preventing violence. Well, they are preventing violence long term. So let's get to it, and maybe you can just say kind of in a nutshell what it is that the genesis of the project. What was the goal when you started?
Yeah, well, and before I do that, I just really want to say, Trina, I just loved hearing about your work. This is really the first I've heard of it. And what I love about it, and there's some consistencies in what I'll be talking about. First of all is when you said you don't come in and tell people what to do, and you'll hear that more from a community organizing standpoint in the way that we do our work here. But the other part that I absolutely loved is that your strategy to prevent violence is to rebuild family and community. And why I want to kind of emphasize that is that when we started our work, one of the questions that we asked ourselves, and we continue to ask ourselves, and I know all of us that do work in this field, there's a central question that we have to ask ourselves, which is, why do people act out violently? And if we believe that people act out violently because it's really our nature to do it, or because we are predators or anything like that, then frankly, Trina, the approach you're taking wouldn't make a whole lot of sense, because you're not changing that. You're just bringing people, you are bringing people together, again, to rebuild family and community. And by doing that, what you're proving is that that notion of why do people act out violently maybe has a little bit different answer than, again, we're predators or we are just naturally going to do it, but instead that maybe we tend to do it when we lose ourselves, when we lose our families, when we lose our sense of community and belonging. So I absolutely loved everything about your work, and I'd love to talk with you more. But coming back to our work here in St. Paul and Ramsey County, as I said, we were directed by our county board 25 years ago now to come up with strategies to achieve primary prevention of family violence. And there are many different things we did over the years, but our Wakanja work is the thing that has really had the greatest impact and strength. And at the core of it, what we do is we use a process that we actually call community system organizing. We look for large systems in the community that affect a lot of people, and with the belief that if we can change some of those community interactions, we can reduce violence, both in those public settings, but then also hopefully later on. In the picture that, Annie, that you have here, and I think a couple of the other ones, what you'll see is that our first partner was the Minnesota Children's Museum, which is kind of interesting because if you think about places where you would expect to be concerned about violence, a children's museum might not be high on your list, but we were actually contacted by them because their staff were really concerned about some of the behaviors they would see, especially in their waiting area when people would be waiting for tickets to get into the museum. And this was now going on probably about 12, 13, 14 years ago. We brought in a child protection worker to talk with them because they wanted to know when to call child protection. I saw some questions earlier on where, when to involve the system. We brought in this child protection worker who listened to what was going on and observed what was going on and actually started laughing and said, what you're seeing is normal human behavior. You are seeing parents who are stressed when they come in to the museum and want to get tickets to get their children in before people judge them as bad parents. And that, of course, those parents are going to escalate in those situations. And so the meltdowns we were seeing were really less about children and much more about parents. So our Wakanja project, and I should just say, one of the connections, Trina, to our work is that Wakanja is actually the Dakota word for child. Minnesota is actually where the Dakota people lived before this country was, well, I'll say taken over. And one of the things that's really pretty stunning and horrifying is there are currently 8 people in the state of Minnesota that fully can speak the Dakota language. It's that far destroyed. And so we were given the gift of this word Wakanja, which, as I said, is the Dakota word for child, by a Native American leader here named Gabby Strong, who explained that that word in English translates as sacred being. And what she said to us was, and to people in our community, is if we truly regarded and treated children and one another as sacred beings, I would say today we wouldn't be having this webinar because we would not be talking about child abuse. It wouldn't be going on. So we were given the gift of this word. We then created a very simple but extremely powerful process that, again, I think mirrors, Trina, your work on more of a community level, where we come into organizations, again, first one being the museum, and then if you think of a continuum with the museum on one side and domestic violence shelters and detox centers on the other side, in fact, sometimes places that don't even interact very much with children. And we bring in a couple of very simple ideas, and there's a slide here, and if you all download it later, you can read it more thoroughly, but there are 6 basic principles to Wakainja, and I'm not going to go through all of them in depth, but a couple I just want to pull out. First of all, the first one is judgment. And what we talk about is that we as humans do judge others, and we always will. And we don't say to stop judging, because we're not going to ever stop judging probably. But on the other hand, what we do say is you can learn to turn that judgment off. And so the simple way for all of you listening in to think about it is, we ask the question, have any of you ever been stressed? Have you ever been at a point in your life where you were not acting your best? Have you ever been at a point where you said or did something that you regretted afterwards? And if you can answer yes to that question, then the next part of the question is, would you like to be judged as that being the person that you are? Is that who and what you are? And we argue, no, it really isn't. So again, if you go back to the Children's Museum example or the domestic violence shelter example, in the Children's Museum, you'd think, oh, everybody's going to be really happy. But again, if you're the parent of a young child waiting in line, you just want that child to behave so that other parents don't give you the look. And I think all of you know what the look is. And so your job at that time, you think, is keep my child quiet and in line. And when everybody's giving you the look and giving you that judgment, it is just not going to help the situation. Another one of the principles is powerlessness. And this is one that in the violence, both prevention and intervention field, gets a little bit controversial. But we've built our work around what a number of people, including Rollo May, who was a psychologist and sociologist, and then Dr. Jim Gilligan, who ran the Massachusetts State Prison Psychiatry System for 25 years, say, which is people act out violently, and now if we even remove the word violence, people don't act their best when they feel overwhelmed by powerlessness, shame, and humiliation. And so once you start to kind of reframe what we're seeing from these are bad parents, because truly, both at the museum and at the shelter and all the different places we work, the conversation usually starts with people assuming these are mean, bad people who are walking in here wanting to be cruel to their children. And once you reframe that to these are people who love their children and are in a difficult situation no matter what, and it could be a difficult situation, interestingly, standing in line at a children's museum or getting checked into a domestic violence shelter, or going to a grocery store when your child is sleeping, or Annie when
Donald,
you take your infant. Excuse me. Sorry.
No, I just took my daughter to Disneyland, and there were so many moments where I try not to judge parents, right, because I work in this field and I just look down, right? So I'm not giving them the look. I'm actually looking away. But there were a lot. They need you at Disney. Let me tell you.
They need at Disney, and the simple one.
Let me jump in. What I want to ask you to describe, because I think what you're describing is this approach where you've really let go of the judgment, and you're starting with how can we change this environment to be more healthful. And can you talk a little bit about what the process looks like? Because you're not coming in with the answer. You're coming in as a facilitator to help the organization itself answer the question, which it's fantastic. Tell us a little about that.
There's another slide on there that has the 6 principles of Wakainja, and at some point I think they'll pop up. What we do is we share the 6 ideas. If you keep going, I think it's
one more?
Next one.
Is it?
I think so.
We only got one left, so hopefully
we didn't get it on there.
Anyway,
we'll send it out to people, but what you all can do is if you take that website, that web address that's on the bottom there, you will find it. I guess the last one I just want to highlight is this idea of the moment. And this is where I'd go back, Annie, to when you were at Disneyland or Disney World or wherever you were. If you think about you want to change and fix those parents, you're kind of in trouble because you can't and you don't even know who they are. But if you just think about in the moment, is there something I could do? Is there a simple thing I could do in this moment to make the situation a little bit better? There usually is. And the answer when you were walking around with all the stressed parents outside there was smile at them. That's kind of what you can do. What we do and the way our process works is we go into these organizations, again ranging from children's museums to libraries to shelters to detox centers. We walk through these very simple ideas which kind of reorient the way we think about what we're seeing. And then we ask a very disarmingly simple question. Can you think about times where you're seeing recurring points of stress and tension here? And make a list of those. And for those of you that are listening in, where you work, think about, are there points of stress and tension that you can just anticipate? So at the Children's Museum, it was parents waiting in line for tickets. At the domestic violence shelter, it was intake. Interestingly, at one local clinic, they said it's 3:30 on Friday afternoons. Every Friday afternoon at 3:30, everybody comes in, they want service, the place is about to close, the staff people are tired, everyone is stressed. So then, once we've identified those recurring points of stress and tension, which really comes out of an idea, and it's on that slide that's up there from the book, The Tipping Point. And if any of you have not read that book, I could not encourage you to read it more strongly, because that's a book that really talks about how attitudes and behaviors spread in populations, and that they can be very, very triggered by environment and situation, which is exactly, excuse me, Annie, what you were saying a few minutes ago. So then we ask people, what could you do to change that? What could you do to prevent it? And the operative question there is, what could you do? So you don't get to rebuild your building, you don't get to hire 25 more staff. Again, going Trina back to your work, what you could do is reconnect people to family and community. In the case of the Children's Museum, the first thing that they figured out was they could send out what they call playologists and funstigators to play with children while they're waiting in line.
I love it. Playologists and funstigators.
Playologists and funstigators. We've actually now, everybody's into evidence-based best practice. Well, we just recently published an article about Wakaija, and that is the first evidence-based practice that we have established. Playologists and funstigators.
I love it.
Yeah, and I want to emphasize, by the way, just as Trina said, she and her program, they don't tell people what to do. We didn't tell the museum to do that. We asked the questions. Where are you seeing these recurring points of stress? And once they could see it's not just inevitable that people want to do it, then that gives you all kinds of ideas of things people would do. At the domestic violence shelter, Women's Advocates was the first domestic violence shelter in the country, I believe, here in St. Paul, Minnesota. And we went through the same process, asked them that question, and they said, well, people often get very agitated during intake. How do you do intake? Well, we bring people into a little room and put them and give them a pile of forms to fill out before they can come into the shelter. They changed the way they do intake. Now and for years, the first thing that happens is they tell people, welcome, you're safe now. Then they bring them, they get them settled in their room, they get them something to eat, and then they fill out the forms with them. They don't just give a person who's at a very high point of stress a pile of forms. To give a very, very different example, on the screen right now on the right-hand side, you'll see a sign that says welcome. And that sign actually comes from work that we've done with the Ramsey County Detox Center. It's the detoxification center for adults here in Ramsey County. We did a similar process with them here, and when they started talking about the things that were stressors, one of the first things was they said, well, people come into detox, they often don't even know they've been brought in because by definition they're intoxicated. They change them out of their clothes, put them in pajamas, wash their clothes for them, and tell them we'll give you your clothes back when you leave. But if you think about coming into a detox center, you might not remember that by the time you actually kind of come to. So that sign that was on just a minute ago actually says right on there, we have your clothes, we wash them, and we'll give them back, which removes that stressor for people. This last slide here is one that depicts something that we've done more recently that's frankly started as more of a domestic violence prevention tool, which is this notion of family transformation, that just as with the word Wakaija, we believe children are sacred beings, in family transformation we believe all people are, and that all people carry this. So I want to, again, just go back to the notion of that in our prevention work, if we start by thinking people are damaged and bad and inherently violent, I really don't know what to do. But if we start with these beliefs, if we start with the beliefs, Trina, that I think you were describing about the inherent strength within community and families, and in this work, the inherent strength within all people, then that goes back, Annie, to why I believe violence is so preventable, because we're trying to take people somewhere that we all already seek, not trying to change something in people.
Well, you know what's coming up for me is that it's not just the family transformation model, but you're also believing in the transformation and the strength of all the people that work in these organizations that are touching families. Like,
absolutely.
You know, because I think a lot of us in this field at one point or another have worked in direct service, and when you see that harsh parenting, as much as you're empathetic to the parent, your options are call Child Protective Services or call the police, and that's not necessarily what I think would be a good solution, and so I don't do anything, right? Yep. Like, I feel like because it doesn't rise to that level, but also we think about those norms on sexual domestic violence, it's not really my business, but then it is my business because they're in my center, and this really really empowers the folks that are, in direct contact with families, that care deeply, that the families usually see as neutral folks that are respectful, the opportunity to really create an environment that just fosters different norms and different approaches. So it's really it's exciting. We need to keep moving time-wise, but I know
if
for
I
the
could
folks
just
that
quickly
have
add,
questions.
I'm sorry,
yeah,
Annie, just one real quick thing. The other thing, and what you said is absolutely correct. The other thing, though, that I would add is that it transforms the individuals both at work and in the way we do our work and in our lives in the community. When people, learn the principles and ideas and practice them of Wakanja, they both work differently in their wherever it is they work. They also act very differently when they go to Disney World or grocery stores. It's remarkable, and which leads to a whole community-wide change. So,
well, and I'm so glad you added that in. I mean, for us at Prevention Institute, this is about sustainability, right? This is about, investing in a change that has growth, that has legs, that can go long term, and that's what you're doing. And it's a really impressive facilitated process. There was a question that Kayla asked a little bit earlier about studies and data, and one of the things I've been excited about is the public health department there in Ramsey, and Donald, thanks to you, you have some really good evidence base and some articles that you've been able to get published. And I didn't pull the links to them, but we do have those links to some of your articles. So if folks are interested, David, do you have those links, or Donald, do you have those links by any chance? Maybe we could get them into the text chat.
Well, probably the simplest thing on that screen that's open right now, that is the link to our Wakanja website.
Perfect.
And that would probably be the simplest thing for people to do. Yep.
Perfect. Awesome. So let me also get to some other data, because we did pull this. I mean, we know that is a thing that you have to do. But let me just add one thing. Organizational practice, also policy, is really important. Another Defending Childhood grantee has a youth commission that has a violence prevention subcommittee that makes recommendations for all of the local government around youth. And then we had Portland, Maine on as examples earlier. They set a standard for their social emotional learning curriculum. So they didn't adopt one curriculum. They said, what are the key characteristics of strong curriculum, and then what do we need here locally, and what do we want here locally for the school district? And that was the work of the group, was bringing this interdisciplinary group together so that when curriculum opportunities came up, they had kind of a standard set of things they were looking for. And one thing they said they wanted to make sure was included was cultural values and respect for diversity, because they have such a strong and growing refugee and immigrant population in Portland, Maine. And so there's a really interesting work that's been doing there. So the other thing that they're doing in Defending Childhood, so they're using comprehensive approaches, not just one thing, different things together. They're also looking at shared risk and protective factors. This starts the conversation about science. And so the risk factors that are kind of shared between multiple forms of violence but are very child-centered, we have some of them there.
And then I love Casa de Esperanza's quote, when you start with needs, you get programs. When you start with strengths, you get possibilities. And I think our two guests today really impressed us with the possibilities you get when you start with strengths. So here are some resilience factors that, again, would go with a child-centered approach, and they have good science behind them. There's things that we've already talked about: family support and connectedness, connection to a caring adult, community connectedness. And if you want the big science behind it, this is a paper that we published called Connecting the Dots. We co-published it with CDC, specifically looking at some of these risk and resilience factors and the science behind them. I wanted to ask really quick, can we launch a poll in the bottom left corner? I wanted to do a pie chart poll and just ask folks, let me skip ahead to the one I want. How familiar are you with connecting the dots? So we did kind of a nationwide web conference tour on this document. Has anyone used it? Have you read it? Are you familiar with it? Or is this the first you're hearing of it? So let's get that pie chart moving. I'm sure none of you have been multitasking. So get back over to your computer and chime in over here. All right.
And Annie, this is Ashley. I'll go ahead and I'll post a link in the text chat to a web conference that we did about this document.
Awesome. Awesome. So for those of you that have used it, we've got a nice chunk of you. And for those of you that have read it, maybe you could chime in the text chat. What do you think about it? One of the things that we didn't have funding to do was to really pilot it and kind of audience test it. So I'm actually, it's been out for about a year. I'm curious, how has it been helpful? And as those come in, I'm going to go backwards a little bit for the 67% of you that it's the first year hearing of it. Let me go back and tell you exactly what it is. So we use the CDC scientists and kind of the branding and credibility of CDC to look at those risk and resilience factors, norms supporting aggression, harmful gender norms, economic opportunity. We've talked a lot about support and cohesion, and tie it back to preventing multiple forms of violence. Those are the abbreviations at the top of your tab, the CM, child maltreatment, teen dating violence, interpersonal violence, sexual violence, youth violence, bullying, suicide, and elder abuse. And so it shows how some of these risk factors are actually shared. We also have protective factors inside of it, not as much data, and we won't want to say that just because there isn't data doesn't mean it's not effective. We're limited in that way. But this does really make that science connection between something like a family night, God forbid a fun family night, and the phonologist. I totally want to change that. I want to be a preventionista phonologist, preventionist playologist. That ties the science back to what you're doing. So there may not be, a huge evidence base for family nights, but you tie the outcomes of your family night to that community support and connectedness. Now, the document is much bigger. I just pulled a couple slides to give you a sense of it. Anyone chiming in the text chat here? Are you seeing anything, Ashley?
I am. I'm seeing a bit of a theme emerging that people just really appreciate that, at the CDC level, they're hearing these messages of let's work across silos. I think that's very important.
Yeah, it is. And I think, again, when you're working with the skeptics, the folks that are much more focused on kind of crisis and in the thick, and prevention feels a little distant for them, it's a really helpful bridge. It's a really helpful bridge. CDC also has another tool which I think is pretty fantastic, Essentials for Parenting Toddlers and Preschoolers. I'm biased as a parent of a toddler and preschooler, but there are some pretty stressful situations for all of us. I related back to Donald, to your comments about, have you ever been stressed? Sometimes I think, have I ever not been stressed in the last 4 years? But this is a universal tool, and that's what's great about prevention is it's geared for everyone, that all of us can benefit from these pieces, and this is a great positive parenting kind of packet out of CDC that's child-focused, but we also know it's connected to some of those risk factors. Playworks is another group that I think is doing really interesting work. They're tying the way they do PE in terms of challenging gender norms, challenging inclusivity and participation during outside play at school, to actually better learning environments and more instructional time in the classroom. I love their work, and they do great evaluations. So if you're looking for data, that's a good one. The other thing we've talked about today a little bit is trauma and building community resilience. This is one of our partners at Prevention Institute, Howard Penderhughes, and he's been working with us to look at preventing trauma at the community level. So we talked about ACEs, adverse childhood experiences, and Howard was really challenging us to think about adverse childhood or adverse community experiences and taking that just from kind of the individual level to the community level. And you see a lot of the things we've talked about are what's coming out of this preventing trauma work as well. And there's some good evidence base for that as we move forward. I think what I want to do, given the time we have, let me just glance at these slides, and I'm going to skip us forward a little bit. And hey, Casey, can you move us to the text chat question? What types of strategies would you like to see integrated? So one of the things that that we've been thinking about a little bit is kind of what's most promising. If we think about a child-centered approach. Oh, not that one. Let's go back. There we go. What do you think would work best when you think about this, the work that you're doing, the mandates you have, as you refine this idea through kind of your regular workday? What maybe would have some resonance with your community, with your supervisor, with your funder? We know we have multiple people to please here. What's kind of coming up for you now in this conversation? And let's go to the text chat and hear from folks. What type of strategies would you like to see integrated into a child-centered approach? And Claudia asked what Howard's last name was. It's Penderhughes. And he's the only one. He was a Pender and his wife was a Hughes, and they came together and made Penderhughes their last name. So if you Google with that, you'll get him, and we're happy to put a link up. I think it's right above that. If you go up to the Community Trauma and Resilience comment from Prevention Institute, is a link to his work. All right.
And this is Ashley. I just posted a link to the web conference that we did with you all and Howard as well. So you can get that.
Yeah, fantastic. Thank you.
Let's see, what types of strategies would you like to see integrated? So,
okay. So Anne is starting us off with more agency funding for family night. And the rest of you are typing. So let's get those answers in. Matt brings us to the community level, trauma-informed communities and building protective factors for resilience. I'm seeing more and more people propose things called like community resilience projects. And I think it's a nice next step for some of the capacity building projects of the last couple of years, and thinking about how do we actually foster community resilience as part of our goals and our outcomes.
Right, and that's what I'm seeing too. Even in this text chat, I'm seeing a lot more of a kind of a positive approach. People looking at what are the positive norms that we want to promote. What do we really want to put in place? And I think that is the trend that's kind of reflected nationwide as well.
Yeah, and we know that, I know Boston, when we were talking with them about defending childhood, they said, the community is tired of being pathologized. They're tired of another program to come fix them. And they really welcomed this kind of partnership approach where it was really positive, like let's come together, let's do something fun, let's do something that's, healing and feels good rather than something that is more focused on the negative aspect. Great. Okay, well, we have some good examples in here. I see skills-based, I see strengths, family-friendly policies in the workplace, integrating gender norms into this work, absolutely. That's from Amy.
There have been quite a few comments about, not blaming parents, but looking at like we see skills that we can put in place as well.
Yeah. And Nathaniel mentions programs connecting families in their communities. One of the slides I skipped over is called Family Place Library, an amazing kind of using the library as a kind of neutral community hub that can support any family, which is wonderful. Matt talks about the approach. Go ahead.
Oh, working with the medical community. That's something I'm a big fan of. I spent several years working with pediatricians specifically around what they could do prevention-wise.
Yeah. And thinking, I think, too, that that's, again, a neutral place, a trusted, credible person, and then all the folks would benefit from that kind of piece. So one of the things that's happened, I want to move forward. One of the things Defending Child has done, again, is comprehensive in nature. They're looking at risk and resilience factors, and they're integrating these strategies. So I mentioned Grand Forks earlier. They're doing social-emotional curriculum universally. They were our guests last month. But they're also doing restorative justice in schools and have been thinking about that as the implication. So they're integrating these things into a plan and a strategy that goes back and forth. In the last 5 minutes, I just wanted to bring up that this work is not without challenges and opportunities. And one of the things that clearly you all are relating to is that there's a strong community support for prevention. But this was not a hard shift to make when it came to bringing it to your community. In Multnomah County, they had all kinds of kind of new partners come out of the works when they started doing this process. And that these sites, the grantees, really recognize the relationship between multiple forms of violence. I put this spaghetti chart in here in the bottom left because I think sometimes with academics, folks get caught up in all the correlations and directionality and, what's the incidence of girl bullying versus elder abuse, and, that we can leave that behind, to be honest. Like, that's important work and good for understanding. But there's a lot of face validity to this. And when you ask community members to understand and think about it, no one had trouble with that. What they did definitely sit with was cross-sector collaboration. And that's one of the reasons I wanted to kind of normalize that and bring it to our group, that when you do cross-sector collaboration, you get more. But it does take an investment. You do have people with different mandates, diverse goals. We use Collaboration Multiplier. It's one of our tools to work through that. And you see the kind of the movement around joint use or shared use facilities where you're opening up schools and community and other government buildings for community groups as one of those kind of joint sectors. People have been able to kind of work through that. The other thing that they were a little bit challenged with was political will. And again, this isn't a crisis, so how is it that you bring it up to the top level? And that was something people had to really think through in their community and be very intentional about. I have this example from Wichita, Kansas. One of my new favorite examples are grandparents' parks, where they have fitness stations for those that are 50 and older, but they also have a playground and paved walking paths. And it was sponsored by the AARP, the mayor, their Parks and Recreation at the county, and local businesses. And I was like, oh, what a cool cross-sector coming together. It's great prevention. It's working on intergenerational connections, but it's also a built environment strategy. And you could imagine if they hired a playologist and a funologist to work the park, how far you could take that into risk and resilience factors. So I think there's just a lot of possibilities. You just have to sit and be intentional about them. And, of course, this came up today. Measuring and communicating success is also some of the challenges that have come about. And this is one of the examples that just came to my attention, and I love it. It's from Harlem in the Bronx in New York, and they're looking about shifting environments, and they want to work with young people in literacy. And we know literacy and violence prevention go hand in hand. And they've created these beautiful collections of books at the barbershops. And they're looking to expand to salons as well. But they're creating child-friendly reading spaces for men and their children in some of these areas that maybe didn't have them before. Very simple, multi-sector, positive, and just beautiful. Last example, and then I'm going to wrap for today, is in Los Angeles. They have transformed these county parks to community hubs in summer evenings for families to come together. They've invited all their community partners. It's coordinated activities, and they have amazing data on the decrease in violence around those parks during those summer sessions. They've tied it to a return on investment, and they've been able to show that those cost savings make the investment for the county worth it, and they're able to really get more and more investments for something like, and this is even beyond, it's a community fun night, really, but it's about bringing those folks together, thinking about how it impacts health and community and builds connections. So this is something that has a lot of resonance. It's coming across the country, and I'm so glad you guys joined us today to really engage in this conversation, think about what you need to be intentional about it, and how to really take it to the next level. So the one in LA, just send me an email. Any of the examples that we talked about today, send me an email and I'll get you back to the links for it. But this is the Health Impact Assessment from Los Angeles County Parks After Dark program. With that, I will turn it over to Ashley for the wrap-up. Thank you all so much.
Oh, well, thank you, Annie, and thank you to our guests, Trina and Donald. And thank you to our web techs, Casey and Alexis, behind the scenes over at Prevention Institute. We really, really are looking forward to continuing these types of conversations when we talk about making the link and making connections, not only between each other, but between multiple forms of violence and other related issues as well. This is about health equity, this is about social justice, and we really look forward to continuing these sessions. So with that, I will close this session out. It is 12:30 Pacific time, and this is officially the end of this web conference. We look forward to seeing you online in the future. Thank you.
Thanks, everyone.